Baxley, and welcome.
Thank you. I'm excited to be with, I think my last time I joined for a presentation was in 2023, so I'm really happy to be back. Thanks for the invitation.
You're
And this is
welcome.
a topic I love talking about because I love sleep. Um, should I just dive right in, Lisa, into the
Yep,
slides?
feel free,
Okay.
dive right in.
Okay. So, does anybody recognize this line from Macbeth? Sleep, the main course in life's feast. It's part of a longer quote, which is really cool, but I thought that was fitting to start us off here. Um, these are just some statistics on the next slide from the National Sleep Foundation that show essentially how common it is for adults in the United States to struggle with sleep. 48% of us only get the recommended 7 to 9 hours of sleep per night, and 26% of adults average 6 to 7 hours per night, and 20% sleep less than 6 hours per night. I'm wondering if many of those participating are in this part of the equation, given that you're tuning in today. The definition of insomnia or chronic insomnia is difficulty falling asleep and staying asleep, or difficulty getting enough quality sleep for more than 3 nights per week for at least 3 months. And there are a lot of people who say that they can sleep less than 6 hours a night and they feel fine. So chronic insomnia is really if that lack of sleep causes distress or impairs your ability to feel like you're functioning at your best during the day. Also, it's chronic insomnia and not some other condition if the lack of sleep can't be attributed to some other type of disorder, whether that's an endocrine problem or a mood disorder. Um, and about 33% of adults at some point in their life will suffer from chronic insomnia, a third of us. This is a slide that I like just to illustrate what we mean when we talk about sleep architecture. I find myself talking about using this term sleep architecture a lot when I'm talking with patients about the potential side effects or the sleep disrupting side effects of medications, because a lot of the medications that people will be put on for sleep can help with falling asleep, but can actually disrupt good sleep architecture. So sleep architecture is illustrated here from polysomnography, which is kind of looking at brain activity during different stages of sleep. Usually we go through about 4 to 5 sleep cycles in a given night, and each cycle is about 90 minutes in duration. And so we start out, with from being awake to going into REM sleep, then stage one sleep, stage two, stage three, and then we come back out of that up into REM again. And sometimes people will peak back up into periods of wakefulness out of REM during the night. And that's actually not pathological. That's a normal thing. For some people, it can create a lot of anxiety, especially if they've suffered from chronic insomnia, but it's not necessarily unhealthy to have brief periods of wakefulness coming out of one of these deeper stages. And there's really no clear guidelines as to how much deep sleep is necessary for health per se, but we do know that deep sleep is where healing happens. And I have another slide to kind of identify that. Most adults tend to spend about 10 to 20% of each night in this stage three deep sleep. And then as we age, it's difficult to get as much time in deep sleep. Um, the issue with medications like lorazepam and some of the hypnotics that are commonly prescribed for chronic insomnia is that they can disrupt the sleep architecture such that people don't spend as much time in stage three sleep. I wanted to say, just comment really briefly on the wearables that are really common. Put your hand up in your Zoom if you use an Apple Watch or a Ring or a Fitbit or something like that um, to measure how much time, what your sleep latency is, or how much time you spend in deep sleep. I see a couple of thumbs up going through here. So the good news is that this is a study that was done at I think it was conducted at Brigham and Women's in Boston, where they were looking at the sensitivity and the precision of different wearable devices for tracking sleep. It used to be if you wanted to know if a person was in stage one, stage two, or deep sleep, that you would have to spend the night in a lab and have wires hooked up measuring body temperature and heart rate and brainwave activity, polysomnography. And that's no longer the case because wearables are actually pretty good um, at picking up whether a person is awake or asleep. When it comes to differentiating the different stages of sleep, they're not as good, but they're not terrible. And so this term sensitivity basically means if the device said that the person was asleep, it's the ratio of the uh, positive, as in, yes, this person is asleep, registered by the device, over the total numbers of actual time asleep as judged by the polysomnography as the gold standard. So for awake versus sleep, I didn't include that data point here, but it was over 90% for both of them. So they're pretty good at knowing if we're awake or asleep. And then when it gets into drilling down into whether it's light or deep sleep, the Apple Watch isn't as good as the Aura. The Aura Ring is not terrible. It will underestimate probably the amount of time you spend in deep sleep. So if you're feeling dismayed that you're not reaching your target for deep sleep, just know that you can assume that there's probably some instances where you are in deep sleep that your device isn't picking up on. And then for precision, this is again, if the if the device was said that you were in deep sleep, how much of the time was it accurate? So it's the ratio of a positive as noted by the device over the total time that the device recorded positive in addition to the polysomnography. And again, these devices are pretty helpful um, at differentiating. Um, so you don't have to go to a sleep lab to know how your sleep architecture is looking. Um, the benefits of deep sleep. So many. Sleep is one of the fundamental things that is part of the pillars of lifestyle medicine for a reason. We know that it influences hormone regulation, um, the hormones that come online that help our bodies repair from soft tissue injury are increased if we have adequate sleep. Our immune system is better able to regulate itself so that chronic inflammation shifts into a resolution phase when people get adequate sleep. We know that chronic sleep deprivation can impact learning and cognition. Um, and that it's in that stage three sleep that our brain's lymphatic system, called the glymphatic system, actually comes online and helps us repair the metabolic or remove the metabolic waste that is produced during the normal business of living day to day. This is another slide that illustrates sort of the multifaceted roles or impacts that sleep has on physiology from the standpoint of our endocrine system, neurologic system, immune system, and cardiovascular system. I just want to mention that this first part of my talk is a little bit depressing because it's like, here's all the bad things that can happen in your body if you don't get enough sleep. But I promise I'll have some positives to end on so it doesn't all make you feel dismayed. But the effects of long-term sleep deprivation, again, can affect cardiovascular system in the form of higher blood pressure. People often notice that if they go for a period of time with sleep deprivation that they gain weight, and there's a reason for that. You tend to have higher blood sugar and higher cortisol levels with sleep deprivation. That can lead to weight gain, particularly weight that's gained around the midsection of the body. People are more susceptible to viral illnesses if they have sleep deprivation and mood disorders. And this comes up for me a lot when I see men in my practice who have low testosterone. It's really gratifying to see on lab results um, the hormonal effect of addressing chronic insomnia in the form of a rising testosterone level. It's beautiful. It's as effective sometimes in some people as giving them androgel. So that's usually sleep is usually a part of an integrative approach to hormone balance. We often focus on adrenal health when it comes to a lot of the issues that people come to see me for, which might be mood or chronic fatigue or immune issues. And focusing on adrenal health can really uh, bring people a long way toward feeling better or toward symptom resolution. And sleep is a huge part of that. The adrenals just love sleep. Um, This was a really elegant, very small clinical study that illustrates the effect of sleep deprivation on weight. So it only involved 12 participants, so a very small study. Half of the individuals were men. They took people who were at a healthy weight, and they enrolled them to do an experiment where they would spend 21 days in a kind of a controlled environment. There were 4 days of just getting acclimatized to the environment of where they would be sleeping with the polysomnography. And then for 2 weeks, it would be stipulated how long they were allowed to have a sleep window as opposed to a wake window. So half of the group would be forced to only spend 4 hours in an environment where they could sleep. And the rest of the 20 hours during that cycle would be awake time. And the control group was allowed to have a sleep window of 9 hours. And then there was a 3 day recovery. And then they had the two groups kind of switch. And so they had the people who were initially in the control group then go to the sleep restricted group and vice versa. And then they measured things like energy intake, body weight, energy expenditure, fat distribution, and some blood measurement of biomarkers. And what they found was that in the sleep restricted group, again, these were people who were only allowed to have a sleep window of 4 hours in a 24-hour cycle, that they tended to eat over 300 more calories per day, that their weight went up by about a pound, and that they had a pretty significant increase in visceral adiposity. So it wasn't just that they gained weight, but that the weight tended to accumulate in the midsection. And that was, again, just 2 weeks of that sleep restriction. So you can imagine what the impact would be if it was, years of sleep restriction, how that might affect different aspects of physiology, particularly with regards to body composition. So why is it that when we're sleep restricted, we tend to eat more calories? Like this, this was again the finding here, 300 more calories a day. The cumulative effect of that could be substantial. And it has, it's probably more complex than just this, but it's important to mention the relationship between these two hormones that regulate appetite and satiety, ghrelin and leptin. So I like to remember that ghrelin is a hormone that stimulates hunger because of the way ghrelin sounds like growl. It's produced by the stomach and it tells your brain that you need energy. You need to bring food in. And it also triggers fat storage. So when you bring those calories in, they can get stored in a depot mode. In contrast, leptin is the satiety signal. So it's produced in the gut and tells the brain enough. We've had enough food. We don't need to keep eating. And what's interesting is that with sleep restriction, even as little as restricting to 7 hours a night, you can get subtle leptin resistance. So that means that your body is making leptin, but it doesn't signal to the brain that you've had enough. And so the brain still wants to eat. This is where we get into this idea of food noise. There's lots of variables that can influence leptin resistance. Sleep restriction is one. Also, just having a lot of adipose tissue on the body can lead to leptin resistance. And then eating certain kinds of foods, like ultra processed foods, can lead to leptin resistance. But we think this is one of the underlying mechanisms by which sleep restriction can cause increased appetite. So, what does sleep restriction do to the endocrine system? This was another study that I thought was interesting. This is, again, a small clinical study. It's hard to get large numbers of people to agree to sleep in a sleep lab for a period of time. So these studies tend to be small. But this one was also 13, and they spent 2 nights. It was, again, a crossover trial where one group was sleep restricted and the other was the control group. And so Group A was allowed to get the control amount. They were given a sleep window of 10 hours a night, and Group B was sleep restricted to only 4 hours a night. And then they switched the groups, and then they measured certain biomarkers. And this time they were interested in again, adrenal function. And what they found was that the sleep restricted group had higher cortisol levels, higher perceived stress, and increased appetite. So again, um, pretty significant impact on stress levels, endocrine function, adrenal health, and probably by corollary weight. Sleep restriction tends to raise blood pressure. So this was a meta-analysis that included a total of 45,000 patients that showed that poor sleep quality was highly associated with a greater likelihood of high blood pressure. And the difference of that is about 4 millimeters mercury on the blood pressure cuff. So keep that in mind if you're, on the cusp of needing to be on a medication to regulate blood pressure, that sometimes getting enough sleep can make a pretty big difference. Again, easier said than done, and we'll have some tips at the end for how to do that. Um, And going from sleeping 6 hours a night to sleeping 7 to 8 hours a night can make a big difference when it comes to blood pressure. Abnormal sleep duration is, this is no surprise, is a risk factor for coronary artery disease, not only because of the impact on blood pressure, likely also because of the just the inflammation. Higher cortisol levels tend to be associated with chronic inflammation, and that can have an impact at the level of the arteries. Um, I told you these first set of slides would be depressing. Sorry. Sleep and cognition. Um, Chronic sleep deprivation is associated with neurodegenerative diseases, specifically Alzheimer's. And this is probably a mechanistic link that has been proposed is this glymphatic system that was really only discovered, I think, in the past 2 decades. I think many people are familiar with the idea of the lymphatic system, which is like the third system of vessels that help move things around in the body. We know about arteries and veins, and then lymphatics clear debris that's created at the cellular level as a result of tissue repair. And the brain has its own unique lymphatic system, but it's really pumping and moving and metabolically active during stage 3 sleep. So the brain is a part of the body that uses a lot of energy, and a lot of metabolic stuff is happening there. And that means that, neurotransmitters are being synthesized, membranes are being repaired, things are being broken down. B vitamins are serving as cofactors for all kinds of enzymes. That's a lot of like busy, busy, busy stuff happening at the microscopic level. And so the cells need a process for cleaning up, and that involves immune cells and the glymphatic system. So we need nourishing sleep. This was really cool. Um, Again, I don't know how they get people to volunteer for these things, but they actually had people agree to have rhinovirus injected into their noses. And they compared the rates at which people actually came down with symptoms after this exposure to rhinovirus between those who were deprived of sleep and those who got more than 7 hours of sleep a night. And lo and behold, people who were sleeping less than 6 hours per night were more likely to develop symptoms from the common cold after having virus injected into their noses. I think this is an interesting slide too, is looking at the vaccine response in people who are chronically sleep deprived versus people who have normal sleep. So they took 133 healthy college students. Half of them had insomnia, half of them reported, again, this was self-report, no insomnia. And then they gave them the flu vaccine and then measured serum antibody levels before vaccination and 4 weeks after vaccination. And this is the people who were good sleepers. You can see they started out with a better antibody levels from prior vaccination or exposure to virus, and then they got a better boost. And the chronic insomniac people still, showed a response to the vaccine. Still worth getting your flu vaccine, even if you're even if you have insomnia, but not as quite the same slope to the line and lower absolute amount of antibodies. Okay, so now what? We know that not getting enough sleep isn't great for our cardiovascular system, our brain, our immune system, and our endocrine system. What can we do about it? So I want to just take a couple of minutes to sort of explain how my approach to treating this might be different from conventional medicine. I'm a family physician by training, but I'm also board certified in integrative medicine, and I have a background as well in functional medicine. So I use oftentimes a functional medicine paradigm in trying to understand how to come up with creative treatment strategies for people, especially when they feel like they've already done the usual avenue of treatment and haven't made progress. So I'd like to use this tree metaphor to explain how I will often talk about things with patients. And so the tree is a useful metaphor because what we see in the branches is the end manifestation of imbalances that happen upstream. So the boughs of the tree, we think of in this metaphor, would represent your constipation or bloating or diarrhea or chronic headaches or hot flashes or weight problems or fatigue, for instance. And you can organize those according to what organ system you think they pertain to, whether it be the brain, adrenals, lungs, gut, etc. But where does that all begin and why does that happen in one person and not another? And so there we go into looking upstream. In functional medicine, we talk about like trying to find the root cause. So go to the roots, and we think of the roots of a tree as being that part of the tree that nourishes the organism, sort of that sends data um, into the system. What are the inputs into this complex biological system? And so in this metaphor, those inputs when it comes to our physiology are things like nutrition, movement, and exercise, the quality of our relationships, how we manage stress, sleep, and relaxation. And then those inputs get filtered into through really what's ultimately like an operating system, our unique genetics, our unique environmental exposures, and the way we, as unique individuals, will process things with a certain cognitive framework and our own individual emotional experiences. So that data input gets filtered through genetics, environment, and our cognitive and emotional and spiritual outlook, and then manifest into different symptomatology. So I wanted to spend a minute talking about this tree metaphor and the functional medicine paradigm because I think it's important to point out that sleep is one of those fundamental inputs and nourishing factors. But the nice thing is that all of these things that are at the level of the roots play off of each other. So usually if you're doing good things in the world of relationships and nutrition and stress management, sleep gets better. And by corollary, if you do good things with sleep, then relationships and stress get better. And so what's fun is just to say, like, you don't have to do it all at once. You just do one little thing and you make one little baby step in one realm, and the system will just rebalance itself. And it can be very gratifying to watch people have that experience with this approach. But we're going to talk about a little bit about all of these um, in terms of what's at the level of the roots, starting with one aspect that's really important to sleep, which is early morning light. Many of you have probably heard of melatonin, which is a hormone made by the pineal gland in the brain, and it's what helps our physiological systems be attuned to um, essentially the movement of the sun and this diurnal pattern of the planet that we live on. Um, Sunlight plays a fundamental role in regulating a lot of our physiological processes. And when we, what people have found is that getting light early in the morning when the sun is low on the level of the horizon tends to do good things to this fluctuating level between melatonin and cortisol in our bodies throughout a 24-hour cycle. It probably has to do with the wavelengths of light that are coming from the sun and reaching our eyeballs and through our eyeballs, our pineal gland at that time of day. But long and short, if you can just get outside for like 5 to 10 minutes early in the morning when the sun is still low on the horizon, it can have a positive impact on sleep quality. It can help people fall asleep faster, and people tend to sleep longer with 5 to 10 minutes a day. Um, so the thing about exercise, this is a tricky topic because a lot of people just hate to exercise. And I often get asked, well, what kind of exercise, do I need to do if I want to improve my sleep? And I'll just say, really, the one that you will do. So any type of exercise is good, is better than nothing. What the studies show is that moderate intensity exercise in particular is good for creating those endorphins and the hormonal shifts that facilitate better sleep. And so, what is moderate exercise? Generally, there's really strict criteria in terms of METs, and if you're a lifetime member, you can drill into that. But I always just tell people it's if your heart rate is going faster than normal, such that you're not breathless, but you wouldn't be comfortable singing a song while doing the activity. Or if you were asked to sort of say on a 10-point scale, 10 would be like complete exhaustion. I can only maintain that for a couple of minutes. That would be vigorous, and you definitely want to kind of dial it back to a 5 or a 6 on a 10-point scale. So moderate intensity exercise. And People are often told that exercising at night is a bad idea if you suffer from sleep, but the honest truth is that some people do well when they exercise at night. I think it just depends on, how long it takes them for the adrenaline and the cortisol to come back down. So if all you can do is doing it in the evening, I think as long as it's, a couple of hours before you're planning on laying down, it could probably still help facilitate sleep if there's not time in the morning. Um, and this is also a statistic that's quoted from studies and this is recommended also by the Centers for Disease Control and by the American Heart Association, that people should aim for 150 minutes of moderate intensity exercise per week. So about 30 minutes, 5 days a week, or 75 minutes of vigorous activity, um, 2 to 3 times a week. But really, any little bit is good. Like, I think don't sacrifice better for best. If you can just do 10 minutes a day, I think that the people get positive hormonal shifts from that can facilitate improved sleep and every one of those variables that nourishes the soil in this tree metaphor. One of my favorites, and this is something I learned from a woman who I'm fortunate to be able to call a prior colleague, is Geeta Maker Clark, is an integrative family physician at Endeavor Health System, and she has a new book coming out about the role of dance and how that can be a really wonderful form of exercise. So if all people can do is just sway to music and do that a few minutes a day, that's a great form of exercise and would likely help with sleep. Um, so one thing that's important to look at is your medication list if you're struggling with insomnia. I think this sometimes gets forgotten. I think most people know that Sudafed can have a stimulant effect, these decongestants that we'll use for the over-the-counter medications for cold. But also beta blockers. Beta blocker medications can lower melatonin levels, so keep an eye out for that. Donepezil and rivastigmine are not as commonly used in most people, although a fair number of people who are struggling with Alzheimer's, those have a stimulant effect. And so that's one thing to look at. Opioid pain relievers, again, can really alter sleep cycles. I didn't list here the benzodiazepine class of medications and other hypnotics. They certainly can help people fall asleep, but they don't necessarily improve sleep quality, and they can alter sleep architecture. This is a big one, and lots of influencers on Instagram love to talk about this, but I think it is real. Blue light refers to a particular frequency or frequency of light, and there is blue light that comes from the sun. It's a natural form of light, but it tends to more blue light comes from the sun during midday, and so our physiology evolved to sort of associate a high amount of blue light entering our brains through our eyeballs as being midday when we're supposed to be awake and alert. And so now that a lot of us are plugged into screens for, 18 plus hours a day, and a lot of that time is concentrated in the evenings when we're using our screens to unwind, the brain is kind of tricked into thinking that it's midday. So it can disrupt circadian rhythms and cause melatonin levels not to rise and can contribute to cortisol levels, or this awake activation hormone, being higher longer. And this is what this is referencing, that using screens in the evening can cause a 1 hour delay in your internal clock. So if you would otherwise start to feel tired around 9 p.m. if you've been on screens, that might be shifted to 10 p.m. I definitely notice this when I'm up at night on my computer, responding to messages or checking emails, that there's just like this activation that comes from that. This is a really interesting finding that sometimes just a subtle shift in nutrition can facilitate sleep. And so I liked this study. It was again small, 26 adults, half of them were men, half were women. And they agreed to spend 5 nights in a sleep lab. Um, the average sleep time was 7.5 hours. And then after night three, um, they went from so I think yes, they did controlled feeding for one day. It was just one day of controlled feeding where they gave one group a high fiber diet and another group a higher intake of sugar and refined carbohydrates. And then they measured polysomnography. And what they found was that people had more slow wave stage 3 deep sleep with a higher fiber intake, and more arousals, and less deep sleep if they had high sugar and refined carbohydrate intake. So the long and short of it is just to eat more vegetables and you might sleep better. Probably also there's a positive impact of the magnesium and other micronutrients and trace minerals that are in vegetables, in addition to the fiber content. So far we've generated a list of less blue light, movement, exercise, and focusing on nutrition to include vegetables and fiber to facilitate better sleep. Caffeine is a big one. Um, and I think what's important to mention here is that I would never go see a doctor who told me that I could never drink coffee. So I usually don't take caffeine away from people because I can't do it personally. Um, Coffee is wonderful, and many of us love it as a morning ritual. But depending on how your body metabolizes caffeine, it could have an impact on sleep if it's done in the second half of the day. Um, and this is because 95% of caffeine metabolism is handled by one particular enzyme in our body. It's called a cytochrome A12 enzyme. And there's a lot of variation in the general population with regards to how rapidly or efficiently this enzyme works. Some people are rapid metabolizers and some people are slow metabolizers. And nowadays, you can actually get a pretty cheap test with a cheek swab to know whether you're rapid or slow if you don't already know just from experience in caffeine. Um, but a pretty high percentage of people are ultra slow metabolizers. So 10 to 15% of us are slow metabolizers, and then the majority are somewhere in between. And in slow metabolizers, the half-life of caffeine is eight times longer than the rapid metabolizers. So half of the coffee that you drink at 2 o'clock in the afternoon is still going to be in your system at 10 p.m. if you're a slow metabolizer. So it's a good idea if you struggle with chronic insomnia to not drink afternoon. Alcohol is another big one. It's certainly can help people fall asleep faster, but it disrupts sleep architecture, and that's been proven on polysomnography studies. Um, I think one of the mechanisms of this is also that the brain needs micronutrients and minerals for neurotransmitter balance. And the way I think of alcohol is like a huge tax on the body's nutritional reserves. So as the liver is doing the work to clean up um, everything that's generated in terms of metabolic waste from the metabolism of alcohol, it siphons away things that would otherwise be feeding those enzymes that help us make serotonin and melatonin. So, if you suffer from chronic insomnia, just try doing a dry January and see if it has an impact on sleep. So this was a question, I think, was it Suzanne who asked, what can I do about hot flashes that might interfere with sleep if I'm not able to use progesterone? And there's a lot of things from the toolkit of integrative and functional medicine that we will try that's hormone free. This is a short list, really. Um, I will say a word about melatonin. Many people will say when they come to me with chronic insomnia, oh, I've tried melatonin, it doesn't work for me. And I think it's important to recognize that there's lots of different formulations and that there's a lot of variation in quality from different brands on the market. So if you've only tried and I love CVS and Walgreens, nothing against them, but if you've only tried their brands and haven't had a good experience, it's worth treating yourself to one of the higher grade products of melatonin, giving it a chance, and especially look for what's called liposomal melatonin because it's absorbed more rapidly, so it really reduces sleep latency better than some of the other products. And a call out, my favorite go-to is a brand called Da Vinci Labs because they make a spray bottle melatonin, and 2 pumps is 3 milligrams, and it really does help people fall asleep. Um, Melatonin is thought to more address problems with sleep latency, so that delay between when you lay down in bed and you actually fall asleep. Um, but a short-acting melatonin for people who have frequent arousals during the night, if you're using a short-acting melatonin like a a liposomal formulation, you can redose it if you wake up at like 1 o'clock in the morning and there's less of a hangover feeling. Everybody's different, so you have to play with it a little bit, but that's just a quick word about melatonin. L-theanine and GABA are amino acids, so don't confuse GABA with gabapentin, which is a pharmaceutical that's often used for things like restless leg or pain or anxiety. GABA is gamma aminobutyric acid, so it's a natural amino acid that is a key neurotransmitter in our brain that is down regulates arousal, and it can have a calming effect. For some reason, even though when we eat things, when we take in amino acids through our gut, because of the blood-brain barrier, they don't necessarily cross over and change the concentration of these amino acids in our brain. They can still have a calming effect. In my clinical experience, it can be very effective for anxiety and problems with arousal and sleep. It's probably mediated by the gut microbiome. So L-theanine and GABA, for some reason, they don't have a soporific effect. It's not as though you take them and you just feel like, oh, I can't keep my eyes open. The way people might experience the effect of like a melatonin or a pharmaceutical for sleep, but they have a calming effect. And so I think that the way they facilitate sleep quality is just by reducing the adrenaline in our bodies, reducing cortisol. And they have a wide therapeutic range. They're very safe to use. I mean, again, don't take any of these without talking to a doctor to do an herb drug interaction check. But in general, L-theanine in particular is one that I've used in kids that have attention problems or issues with performance anxiety or school anxiety. I've used it in very elderly people. So they're well tolerated and they're not as likely to interact with pharmaceuticals because they're amino acids. So our bodies just already are familiar with these and can break them down very cleanly. GABA is one that's produced endogenously in our bodies. L-theanine is found in high concentrations in tea. So it's one that you've probably already been ingesting in less concentrated form anyway. Valerian root is a favorite in integrative medicine and the herbal medicine tradition for insomnia. I often will use valerian root both for insomnia as well as for helping people get off of benzodiazepines if they've been dependent on lorazepam or Ativan or Xanax for sleep for a long time and want to try to get off of it. Valerian can be really nice. You can combine it with benzodiazepines. They're safe to take together. And then once your body gets established on the valerian root, you can try to reduce the dose gradually on those medications. But something important to keep in mind for valerian root is that it is an herb, so you do have to be very careful about herb drug interactions. And it takes like 4 weeks to work. Some people do notice an effect right away, but you really don't see this botanical shine until you've had it in your system for about a month. So it's good to not give up on it after just a few days. Lavender is a long-standing, it's essential oil from lavender can have a very calming effect, and there are really high quality supplements on the market that are patented. And I've had good clinical experiences with patients struggling both with insomnia and anxiety using lavender. If you're interested in trying it, I would say talk to your doctor to do a drug herb interaction check and then source it from a high quality source. And the wellness shop at Endeavor's Division of Integrative Medicine in Glenview is a good resource for high quality lavender. Um, Magnesium is important to mention here. It's a mineral that's a statistic that's frequently thrown around is that magnesium is an essential cofactor for like 400 different enzymatic pathways in the body. So enzymes are proteins in your body that do the work of keeping you alive. So if ever you're injured and you need to repair something, an enzyme is doing something to bring white blood cells to the area. If you need to synthesize something, an enzyme is doing that work. If you need to break something down, an enzyme is doing that work. Protein enzymes can't work by themselves. They need vitamins and minerals as like a boost. It's like kind of like the fuel. We call them cofactors in biology, and magnesium is one of the key ones that the human system was just um, designed to need. And unfortunately, because of numerous factors, in large part, probably our soils are not as rich in magnesium because of modern agricultural practices. but also high caffeine intake. We pee out more magnesium. The more coffee we drink, we lose magnesium in our urine, and really high stress levels, so high cortisol and adrenaline. We tend to lose more magnesium in our urine. So those can all be reasons for people to be magnesium deficient. And so it's thought that about 60% of Americans are magnesium deficient. And so taking a magnesium can help with sleep, and in my experience, there's different formulations of magnesium. Magnesium is commonly used as a stool softener. So if or a laxative, if you've taken magnesium citrate or magnesium oxide, it can be really effective for constipation. But most of that magnesium stays in the colon and just pulls water into the colon to bulk up the stool so you can have an easier bowel movement. If you really want to get magnesium into the cells or into the brain, magnesium glycinate or magnesium threonate are better forms. Measuring a blood magnesium level is not a really useful way of knowing whether you have magnesium deficiency, and that's because most of our body's magnesium is inside of our cells. Our kidneys do a really good job of keeping the blood magnesium level constant, even in the face of total body deficit, just because magnesium is so important for um, key keys body systems like the heartbeat. And so your kidneys will pull magnesium from everywhere to make sure that there's a constant concentration um, in the bloodstream. So you can't know just because you had a normal serum level that you're not deficient. And I'm happy to take more specific questions. There's certainly pharmaceuticals that can help with hot flashes that are hormone free. A lot of those are in the category of antidepressants, like Effexor is sometimes used, gabapentin is sometimes used. But I often like to start with the nutraceuticals because they tend to have a better side effect profile and lots of additional benefits aside from just sleep. So, this is a slide. These are two of my patients. I sometimes do salivary cortisol testing on people to get a sense as to the degree to which adrenal dysfunction is contributing to symptoms. And so I've had patients say to me, "Thank you so much. I had to spend $120 on this test to find out that I'm stressed. Not sure I needed that." And that was a fair point because most of us know when we're stressed and we don't necessarily need to spend the money. But there's also sometimes something very powerful about seeing it in black and white. And so it can really motivate, putting resources toward trying to address stress as a key driver of what's going on with our health. And so this is the result of a salivary cortisol test that's done by a company called Genova Diagnostics. And it's showing that our cortisol levels, again, this adrenal hormone cortisol that is responsible for arousal, fluctuates during a 24-hour day. It rises in the morning when we're supposed to wake up and be alert, and then it kind of gradually falls over the rest of the course of the day. Um, and unfortunately, in a lot of us, it does this. And just this little amount, this it should not go back up at night before bed from its afternoon um, reading, and that upswing can sometimes be enough to make it hard to fall asleep. Um, and so we have to think about what's going on in the evening that's activating and arousing. Cortisol doesn't just go up for no reason. Like there's usually at some level, at the level of the subconscious, we're feeling vigilant about something, we're feeling threatened about something. It might be that your brain, your conscious brain knows that you're safe and you're at home and you're um, relaxing in your bed, but things that happen in the mind are real to the body. Thoughts are very real to your adrenal glands. And so perseveration or rumination or a fight with a spouse or something you're watching on the news or something that you read can be sometimes arousing. This is why I like this quote this is a psychologist, Rumen Nyman, who teaches at the University of Arizona with the Andrew Weil Center for Integrative Medicine. He's written a really nice book about sleep, and he has lots of pearls. And one of them is that we should sometimes think about rather than falling asleep, we have to practice letting go of waking. So if there are activities that are arousing or activating later in the day, would that be something we could let go of rather than thinking of what we should take for sleep? Is there something we could take away during the day that might facilitate sleep? Just something to kind of meditate on. Um, I'm just wanting to mention to the people who've written in with questions, I will come back to the questions about sleep aids, BPPV, magnesium brands, and brands for theanine and GABA. Please do put more questions in the chat. Those will be fun to go over together. Um, so, a word about mindfulness. Look at this image and what it's trying to illustrate about the fact that so much of our lives we spend in our heads. Um, and ask yourself if you've had very many moments in the last week where this was your cognitive experience of a given moment, where you were actually grounded in that moment and taking it in. And I will say it's virtually impossible to do this because you are human. You know, even if you're thinking to yourself, I am at the park on a bench looking at a sunset. I am calm. I feel the bench beneath my feet, or sorry, beneath my seat. At some level, your brain is still saying, aren't I doing great? I'm meditating. This is good for my body. I should be thinking about the sunset. I should be focused on the sunset. Like there's such a meta to everything in our minds that it's virtually impossible to really attain this state. I mean, I think there are probably Buddhist monks who can do it, but for most of us, it's really difficult, which isn't to say we shouldn't try. But it's my way of really encouraging people to stop aspiring to this all the time, but instead to realize that this is the human condition and to acknowledge it and not judge yourself for it and just observe it and then focus on breathing. You can't really empty your mind, but you can focus on breathing, and it's incredibly powerful. Um, So I want to just spend a couple minutes on breath work, and then I'll stop and take questions. But this is my favorite thing to teach people in terms of mind-body strategies to help with insomnia. There's lots of research that's been done on breath work, and it is an effective tool for addressing lots of different aspects of our physiology, immune system, mood, blood pressure, um, nerve pain, chronic pain. It helps with asthma, it helps with COPD symptoms. And why is that? It has to do with the proximity of the brain's breathing center to the brain's arousal center. So the when the arousal center senses rapid, shallow breathing, that tends to activate neurons in the arousal center that release epinephrine or adrenaline. And when the brain senses a slow, controlled exhalation, a different set of neurons in the arousal center fire that kind of shift our autonomic nervous system into a rest phase, or the parasympathetic phase. And that can be very, very subtle and wouldn't necessarily pull you out of a panic attack per se if you were in the midst of one. But with a regular disciplined breathwork practice, it does create a shift in perspective, and a shift in terms of what your adrenal glands are doing cumulatively. So 478 breath work is a really, this was a technique that was made popular by a doctor named Andrew Weil, who's sometimes credited with being the grandfather of integrative medicine, with really bringing integrative medicine to a wider awareness in the United States. And I think he developed this technique from his own study of Hatha yoga. And so it's, a breathing in through the nose, holding for over 4 seconds, holding for 7, and breathing out for 8. And you can Google Andrew Weil 478 breath work, and find a very cute YouTube video of him teaching how to do it. I tell people to try to have a disciplined, regular practice and not just use it initially in moments of panic or anxiety or when you can't fall asleep, because it's really more powerful in those settings if you already have a regular practice that you've been doing. And some people don't like the breath holding. For some people, that can cause a feeling of anxiety or panic. And in those people, I would just say do, in over 2, out over 4, or in over 3, out over 6. Just that slow, delayed exhalation is what sometimes is enough. This is a Buddhist affirmation that I like. Breathing in, I see myself as a pool of still water. Breathing out, I smile at my reflection. So if you don't want to do any counting, you can just breathe in and breathe out and say that to yourself and see how it feels. Another word about the breath from a Buddhist teacher, Thich Nhat Hanh. Breath is the bridge which connects life to consciousness, which unites your body to your thoughts. Whenever your mind becomes scattered, use your breath as the means to take hold of your mind again. So while you're sitting on that bench feeling really good about yourself for looking at the sunset, and then feeling really bad about yourself for thinking about how good you're thinking about yourself for looking at the sunset, just feel what it feels like to have air moving across your nostrils and focus your mind on that. And that does really powerful things for your nervous system and your immune system. Um, Common mistaken beliefs about sleep. So this is again from Ruben Nyman, the sleep psychologist at University of Arizona. Oftentimes, we give ourselves a hard time if we don't sleep 8 hours a night, but personal needs really vary. Some people do feel okay with 6 hours a night. And again, the definition of chronic insomnia is chronically reduced sleep if it leads to impairments in functioning. So if you feel fine at 6 hours of sleep and you don't have high blood pressure, um, then it's probably enough for you. Again, as we talked about when we were looking at the stages of sleep with the polysomnography graph, it can be normal to have awakenings during the night. It's not something to panic over or to think that, it's not anything pathological necessarily. If it means that you can't get back to sleep from early morning awakenings, that's something different. But many of us wake during the night, and if we can remind ourselves that it's okay and not feel panicked, um, most of the time we can get back to sleep, and we won't be worse off for having been awake briefly. Those awakenings are when I will sometimes tell people to use the short-acting melatonin or the theanine GABA because they don't have a hangover effect for most people. If you have a long sleep latency, so this means you are putting yourself to bed, but you're laying there horizontal, staring at the ceiling in the dark, and you're not falling asleep, or you've been asleep, you wake up and you can't get back to sleep. It's good to get out of bed. It's better to not just lay there and stew. And that's because the brain kind of gets entrained to associate being horizontal in a dark room with wakefulness and sometimes with anxious wakefulness. And so you want to disrupt that association and get out and not necessarily do like, okay, I am awake. I'm just going to go do laundry or balance my budget. That would not necessarily be sleep promoting. It's better to do relaxing things or just think of that as reclaimed time when you can just be with yourself and do something calming. Whether that's reading, not on a blue light tablet, but a book or journaling or prayer or just breathing. Um, the other thing is to not catastrophize occasional nights that are sleepless. Like our bodies are incredibly resilient. We're human, and you will bounce back. Um, uh, Sleep latency is sometimes, up to 20 minutes or even longer. I think also people's sleep latency varies. And so if it takes you 30 minutes to fall asleep, but then you can fall asleep and feel rested when you wake up, that's fine. I think it's also common for people to just assume that because they are aging or in their, seventh or eighth decade or higher, that they just won't be able to sleep as well. And it is sometimes a common thing that happens with age, but it's not necessarily healthy or normal. And I think it's also because we sometimes don't address, um, other endocrine issues or micronutrient problems with aging. And so sometimes supporting those older people shouldn't necessarily suffer from insomnia. That was my last slide for the formal presentation. I'm happy to go through the questions that came in on chat and if other people want to ask questions. Um, Lisa, should I just kind of go through them one by one on the chat, what's already been put in the chat?
Yeah, that would be great. I'm going to keep the recording going just so we can have these questions and answers in the recording if we choose to
Yeah,
leave them in. And do you want me to read the questions or do you want to read them yourself?
I can read them. I have the chat, so I
Okay,
will, or if you
sure,
want, maybe, do you want to curate them? Why don't you read the questions and then I'll
sure.
respond? Yeah.
Happy to.
hmm And I'm
All
going to
right,
should I
first,
stop sharing my screen
sure, that
just
would
so we
be
can both
fine.
see? Okay.
So we can all see you.
hmm
Perfect. Okay. First question, can the natural sleep aids affect BPV and vertigo?
Meaning, would they maybe exacerbate BPV or vertigo or make them better? I will assume it means it could be either way. So, no, I have not seen melatonin, the things that I commonly use as a natural sleep aid, magnesium glycinate, theanine, GABA, melatonin, or valerian root. I've not seen those make BPV worse. Um, if anything, I would think that helping with sleep, it might make it better. I think one thing to note, though, with regards to maybe postural dizziness, is that theanine can have a very subtle blood pressure lowering effect. Um, so that's just something to keep in mind. It's very subtle.
And then another question came through. I don't recall which part of the presentation this was for, but the question is, can you please give which company and amount you recommend? I think this was during the supplement section, and I believe we were talking about either L-theanine and GABA or lavender.
Yeah. Um, so I a word about the nutraceutical industry. Um, it's a huge many billion dollar industry. Um, and that does not mean that that's not serving a really important role in the marketplace. That there is a wide range of quality. And that has a lot to do how different products differentiate themselves in quality is due to a number of things. One way in which they differentiate themselves is what kinds of excipients are in the capsules. So if you see some of the lower cost nutraceuticals, they might have red dye or yellow dye or blue six in them. They might have talc in them. They might have other titanium dioxide, just things that are probably in small amounts not harmful, but if it's something that you're taking every single day over many months, you might just want to avoid exposure to that. So that's one thing to think about. These products are not regulated by the FDA, so you're putting a lot of faith in the company that's producing them, that they're doing their own due diligence to test for quality and purity. And these companies do some of them do hold themselves to a very high standard. And so I tend to use curated dispensaries that do the work for me of making sure that the companies I'm recommending have a certificate of assurance that show a high quality. So that's an online service called FullScript, or you can use a health food store locally that you trust. And I've just tend to refer people to the Endeavor, the Division of Integrative Medicine, North Shore Wellness Shop, because I know that everything they stock um, adheres to those highest standards. So that's just a word about supplements. And then specifically with L-theanine, GABA, some common brands that I recommend are Numedica or Quicksilver. They're very good for the rapid acting sprays. Um, Theanine and GABA come both as a spray that you would spray in the mouth, hold for 30 seconds, and then swallow. And then a lot of it is getting absorbed very quickly that way. Um, you can also take them as capsules, and the dose would depend on what formulation you're taking. So if you're using a capsule, it would usually be higher dose, sometimes up to even 700 milligrams for GABA or 200 milligrams for theanine. But you do want to watch out for the blood pressure if you're using higher doses of theanine. Um, yeah, probably enough about L-GABA and theanine. And then with regards to lavender, Lavella is the brand that it's a product called Lavella by Integrative Therapeutics. It's 75 milligrams and it can be dosed either once or twice a day. But because that is an essential oil and herb, I always do a drug herb interaction checker if I'm recommending that to people who are on pharmaceuticals. Um, I always check theanine and GABA as well against pharmaceuticals, but I've never seen it come up as an interaction because they're amino acids and not more complex in terms of body chemistry.
Thank you.
Melatonin, there's a question really quickly about melatonin brand. I use Da Vinci, it's DAVINCI Labs, and they have a liposomal spray that I kind of love. It's just 2 pumps is 3 milligrams, and it's it's really nice for getting to sleep quickly. And again, that one doesn't tend to have, everybody's different, so you don't want to, apologies if you have a different experience with this, if people end up trying it, but I think that it can be used for early morning awakenings if you can't get back to sleep without a hangover effect as well. Um,
Next question. What
yeah.
is the difference between the magnesium you recommend compared to magnesium calm? And I recall that was when you were talking about magnesium glycinate, and
Yeah, I'm
magnesium
pretty
calm
sure
has citrate. I
Is
just
it
looked it
called
up. It has
citrate?
citrate.
Yeah.
Hmm.
Citrate. So citrate can also help with relaxation or like muscle cramps. It's very good for gut motility. Again, magnesium citrate is one of those chelates of magnesium that we think of as pulling water into the colon to soften the stool. And magnesium glycinate is a chelate with glycine, and glycine tends to have a calming effect. It's Glycine is an amino acid that the brain uses to make good things with. Glycine, there's another question, I think, by Suzanne. There was a question down there somewhere about what can help with frequent awakenings to need to use the restroom. And glycine, I didn't include that slide, but there's a really cool, elegant little study of women who suffer from overactive bladder, who have to wake up a lot at night to urinate. And they actually hooked them up in a sleep lab to polysomnography, and they gave one group glycine, 3,000 milligrams, and they gave the other group no glycine. And I think everybody got like, relax, breathe, don't drink water right before bed, all the usual care. Um, and the glycine group had more time in stage three sleep and fewer nighttime awakenings than the non-glycine group. So I often will recommend something called NAC glycine, which is N-acetylcysteine paired with glycine in a powder, um, a couple hours before bed if people have a problem with overactive bladder interfering with sleep.
Good info.
That's by Pure Encapsulations. I shouldn't be promoting all these products so much, but it's just practical
Well,
sometimes
if
to do.
you all go into the wellness shop, it's like I call
Yeah,
it my candy store.
yeah.
Next question. Also, what about cannabis, etc., for sleep and hot flashes?
Yeah, I think so. Cannabis is really interesting. It, I think for many people, it really can help. I think you just have to realize that it's a huge market and there's a lot of different molecules in the active ingredients. And so you just have to know that you're getting a good product. Um, and cannabis can refer to cannabidiol and it can also refer to THC. And then there's other types of molecules that are in the cannabis plant as well. And THC is the part of the cannabis plant that is considered psychoactive. So when we think of the euphoria and the high that people experience when they use cannabis, that's THC. And if you don't want to dabble in that, you can just get CBD products that can also be very good for promoting sleep. Usually the THC is the thing that really like people feel it, but CBD by itself can be very relaxing. And there's a particular formulation called CBN that is thought to be particularly good for sleep. Um, what I've come to realize is that the more I learn about cannabis, the more I realize I don't know. And the more I realize the people who actually use a lot of cannabis know more than me. And so on the one hand, like I would not say, oh, just go and talk to the 20-year-old bud tender who works in the dispensary for advice on that. Like, don't do that. Um, but on the other hand, you can sometimes get very good advice by people who are in the industry because they know, okay, we sourced this from this farm. They don't use um, herbicides. It's this strain, which is less activating than this strain. Like there's a lot of nuance to it. Um, there are hopefully, accessible to this crowd more and more doctors who are developing an awareness for how to use medical cannabis. A good rule of thumb is indica is the strain that's calming, relaxing, as opposed to sativa, which would be more activating. If you're talking when you're talking about THC or full spectrum, if you wanna just dip your toe in the water, and then I would stick to CBD. But you do have to be really careful if you're on blood thinners with because CBD and cannabis can change um, how blood thinners will behave in the blood and can interfere with the metabolism of those.
All
Um,
right, next. What level of sleep might night sweats occur? Any thoughts on what causes them?
oh gosh, that's such a good question. I will say I don't know what stage of sleep. I don't know. That's a really good question. I do think that it can be helpful to play with this idea that the estrogen and testosterone deprivation that tend to trigger hot flashes might be like thinking about where the thermostat is set. but that cortisol is the on-off switch of the thermostat. So even if you can't necessarily directly address the hormone deficiency that might be causing hot flashes, you can modulate the intensity by figuring out ways to not have cortisol and adrenaline spikes close to bedtime. Um, and so if you're someone who's suffering from hot flashes and you can't use hormone replacement therapy, um, do pay attention to blood sugar imbalances, do pay attention to dietary fiber, caffeine, um, things that will trigger a cortisol spike during the day and see if that can mitigate the intensity of the hot flashes.
Thank you. Any tips for sleep apnea?
That's a great question, and I'm sorry I didn't focus on sleep apnea very much during the talk. It's so common. Um, I think if you get a sleep study done and you're told that you have sleep apnea, it's important to know whether it's mild, moderate, or severe. I think that it's also important to know from those reports where how you were sleeping when you had the most apneic episodes. So if it was on your back, then try one of those cool pillows with the tennis balls in it that help you remember, or a sleep pillow, a body pillow to help you remember to sleep on your side. And for a lot of people, that can be enough. Um, I also think that mouth taping is something that more people should try, probably. It can sometimes help a lot with snoring and wakefulness. It's not if you have moderate to severe sleep apnea, mouth taping is not going to make the difference. But I didn't talk about mouth taping in the book. There's a really in the presentation. There's a good book by a journalist named James Nestor called Breathe. He's not a doctor, he's not a scientist, he's a journalist, but he's a smart, quirky guy, and he did a really deep dive into how bringing air in through the sinuses, air that's moist and warmed, how that can change so many aspects of our health, but also quality of sleep and the soundness of sleep and sleep architecture. Um, so that's something to think about. And there's a simple protocol that he recommends for if you want to try mouth taping. Mouth taping does not mean that you put duct tape over your mouth. It's not that. It's like a loose piece of tape from here to here, and you can still breathe around it and talk around it. And you put it on before you lay down just to get used to having it on while you're up and about. And over a period of about a week, you start to spend more and more time laying down recumbent with the tape on before you actually leave it on when you fall asleep. And that can sometimes make a big difference for awakenings during the night.
Thank
So I
you.
would say for sleep apnea, just try to differentiate the degree to which body position is playing a role with the frequency of apneic episodes and try positional or postural changes if possible. And then weight loss is obviously can be helpful, but that's easier said than done. And it's
All
complex.
right, we're almost out of time. I know you have a hard stop, so just let me know. We have a couple
Mhm.
more questions. Also, what about waking for urination? I think you touched on that a little bit.
Try glycine.
Mhm. And your favorite melatonin again, I think we got that. And I was desperate and went on trazodone. Can I safely shift back to naturals? I've
hmm
taken trazodone for 40. Oh, and then another person said I've taken trazodone for 40 years.
Yeah, trazodone is, I think, a really safe pharmaceutical for sleep, and people can use it long term. It doesn't tend to cause dependency. And I don't think of trazodone as a hypnotic in the same way that others are. So I don't worry as much about that one for disrupting sleep architecture. Um, and so if trazodone is helping you, don't have anxiety about being on that. And don't feel badly about trying it. It's a really reasonable thing to try. The nice thing about trazodone is that it you can also in many cases combine it with the natural sleep aids. So it would be safe to use it as well as um, the amino acids we talked about, theanine and GABA, melatonin, lysine.
That's all the questions. Thank you, everyone, for submitting
Yeah.
questions. Dr. Baxley, this was amazing. I'm sure you could keep talking for hours and hours, and we'd all be so thrilled to hear you keep going because sleep is such an important piece
Mhm.
of everybody's life. I was really excited to have you on, and we really appreciate you taking the time out of your day to do this presentation. I can tell it's a passion of yours. I think sleep,
Yeah.
it just comes across. I can tell you're really passionate about teaching.
Mhm. Thanks for having me.
So
This was a joy. I appreciate it.
good. Well, thanks, everyone.